Welcome to the Body Smart Podcast, where we remove roadblocks to fitness and health to empower you to master your health habits. We help you become body smart.
Hello, everybody, and welcome to the Body Smart Vodcast. I'm so excited to have you here today. We've got a really interesting interview with somebody all the way from Boston, and actually he's coming in from Australia originally. So his name is Ithamar Jotkowitz, and he is a practicing physical therapist in Boston right now. He is the owner of Outback Physical Therapy, and he also does metabolic testing there in Boston and does some pretty amazing things with it. Has tested some amazing athletes. And so I wanted to get him on here and have him share a little bit more with you, how he got into that, why he got into that, and how that's helping him and his patients and his practice to thrive. Also wanted to talk with him about kind of the motivations behind why he started doing that. Like what really drove him to want to help people in this way. And so Ithamar, say hi to everybody.
Well, everybody, great to be here. Thanks for having me on.
Yeah. So I met Ithamar a little over a year ago, about a year ago. We started talking. Yeah, met online, not in that way.
Good relationship.
Yeah, they're great. Online relationships can be good. So met online and just started talking about the metabolic testing. And so tell us a little bit more about why you sought that out, why you thought that might be a good fit for your practice.
Sure. So yeah, I opened up Outback about 6 years ago, heavily focused on manual physical therapy, general sports and orthopedics. We became a running specific type of a clinic. So a lot of runners started coming to us, mainly because all of our staff were runners, many completing many marathons and the like. So we started attracting runners. Like I said, almost became specialists in runners. We have a bit of a reputation that when doctors told you there's no more running, that's the only way your knee's going to feel better, come to Outback and we'll get running again. With a pretty, 100% record on that, which we're quite proud of.
That's a great reputation to have.
Exactly. And as we know, if there are any runners out there, no one's going to tell you to not run. So it's kind of nice to know how to do it and actually not hurt yourself. So like I said, we had a pretty good hit rate with that. And then with all of our runners, or many of our runners, they were healed, they were feeling better, and they were kind of now looking for the next level. So it's like, well, I injured myself maybe because my form was wrong, or maybe because I wasn't cross-training, whatever it may have been. But now we're trying to look for the next level. What can kind of get me to the next level of training? How can I get that Boston qualifying, the BQ? How can I take 10 minutes off my personal best time? And so I was starting to look into some of those options, and metabolic testing, VO2 Max testing, really seemed something interesting. I remember learning about it back in PT school 100 years ago, and sort of remembered what it was and how it was and some of the terms. And, if we believe in coincidences, I don't know if anyone really does. Online, I see this guy from Utah who's lecturing about how PTs could be at the forefront of VO2 Max testing. And it was like, I think he's actually speaking to me. So I reached out to Cameron, Dr. Garber, and the rest, as they say, is history.
Yeah, and it has been a fun journey to kind of see you learn more about it. Obviously, like you said, everybody learns about it in PT school. It's part of our initial training, but we were originally taught that it's kind of just a thing to do in the laboratory or in research facilities, and not really something that you can do in a traditional physical therapy clinic. And so we all just kind of like memorize it for the test and then push it to the side. And so it's been so fun on my journey of kind of helping people understand that this is something we can do in the clinic now because of some of the technology changes that have come about. And, using the core cardio coach that we both use has been a huge game changer in the technology, being able to be that clinical effectiveness, but with the research level accuracy has been great.
Yeah, 100%. And it's funny because I remember we were chatting about that when I first went over to Utah to do training. And not long after coming back, chatting with some of the running coaches in the area, talking about VO2 Max testing, and the standard response was, it's like, well, sure, but that's only going to be done at one of the big hospitals or big universities.
Right.
It's like, how I told you at a fraction of the cost, we can do it with just as effective, if not even more effective, just down the road in our clinic. And it's, for people that are very much in the know, it's jaw-dropping that it's actually so accessible.
Right. Oh, absolutely. When you talk to some of the elite runners, they're like, I've always wanted to do that test. I just never knew how to do that effectively. Or I tried it once at a university, but they really didn't give me any information. They just printed out the raw data and I had no idea how to interpret it.
Exactly.
Yeah. And so being able to give people actionable information for not just the athlete, but also for, people looking to lose weight or people looking to improve their fitness, it's huge. For runners, fitness and general health and weight loss are actually, that's a big topic because, losing weight for a runner can actually help them improve their running and other things. So there's a lot of applications for it. I love that you're using it with that elite athlete. And in Boston, with the Boston Marathon being one of the big dog races, you have a huge opportunity there. How has that kind of played out for you?
So it's playing out. It's as we know with everything, it's all about word of mouth. So someone somewhat elite does it, and then the competitor's like, hang on, I just saw on Instagram that you were on that. I can beat that. Kind of started purely with runners, mainly because I had connections in the running community.
Absolutely.
Very much involved in the OCR community, the obstacle course races, so Spartan race, Tough Mudder, and that type, which is interesting because that is running, but then it includes things like climbing, lifting, different. You have the running part of that training, but then you have the working out part of that training. And as I'm sure we'll talk about within the heart rate methods that we recommend for training, that can be really helpful. A professional boxing coach got in touch and suddenly became professional boxers were coming in.
That's awesome.
Their level of endurance that's required as well. So it's kind of amazing how that goes, and almost like a little bit of competition gets the next person's like, I saw that, I can beat that. But one thing I wanted to mention as well, we always talk about the elite athletes, but where I've been having a lot of success is with the non-elite athletes, with people that are starting out with running, people that often, walk into the gym and say, VO2 Max, so I've seen that on the Gatorade commercial, I've seen that on Hard Knocks, whatever it might be. But in reality, that's not for me. Why would I do that? And it's like, well, again, like I said before, fraction of the cost, and it can give you that baseline to really get you going to. So if you want to get into running, this is the way that you can actually get yourself going, as opposed to, just buy a pair of shoes and run and see how fast you go, and you knock out after half a mile because you've been pushing yourself too much. It's a great way of starting up. So we're really trying to push that and having a lot of success there as well. Right.
And I find that to be such a critical point, that so many runners, especially if they haven't ever run before, or they used to run, back in high school or college or something like that, and then they're getting back into it, and they just go out and they run as fast as they can for as long as they can. And then they notice, like, they progress for a while and then they plateau really hard and they stop making progress and they're frustrated or injured. And so starting off a regimen or starting off a running program with a metabolic test gives you the best, most actionable information to start off in a way that you can be healthy and that you can slowly progress and keep progressing, rather than progress and then flatten out and never really progress anymore. This gives us real information about how your body uses calories, so you can keep moving, and we can do so in a way that keeps you injury free. So, as a physical therapist, that's our worst nightmare, is to set somebody up with a program that actually does them harm, makes them worse. And so this gives me information that I can know spot on that if they train this way, their risk of injury is going to be much, much less. That's one of the things I really love.
And as we were saying before as well, so it's like, well, this seems strange. And some of the response I get is, why is this physical therapy? Why you're not cranking on someone's knee, you're not pushing on someone's muscle, but it's exactly that. When it comes down to with PT, we identify the core issue that's a problem that needs to be addressed. We address that, and then usually with an exercise program and exercise regimen, we get them back to where they want to be. So this is exactly the same. It's just the exercise program is heart rate based training.
Right. Right.
And so we kind of identify where they're at now, give them the tools of what they should do, and then reevaluate later on. It's physical therapy.
Right. Absolutely. And too often we get pigeonholed as physical therapists, and we do it to ourselves as well, as being just a rehabilitative provider instead of a preventative provider, right? If we can get out ahead of things so that we can preserve movement rather than just work on movement that's now broken down, we can help people really achieve their goals And I think that's the bigger differentiator with this, that we can help people get out ahead of the roadblocks that normally creep up with runners or with people looking to get fit in general. If we can help you have the right program to begin with, but also if your foot or your knee or your low back starts to creep up, we can nip those symptoms in the bud at the root cause though. Too often we treat just the symptom level of things. This hurts, oh, we treat that for a few weeks, and we're really just treating symptoms, not the root cause often enough. And this allows us to get at the root cause even before that root cause is a problem, to make sure you never come into a problem.
And even taking that to the next level, there's always been a bit of a push that just like there's an annual physical with your MD, there should be an annual checkup with your physical therapy, physical therapy, where you get all those baselines. So, there's a very strong argument for that. And, there's obviously political and reimbursement issues based on that, but it makes a lot of sense. And having a baseline VO2 max for anyone who's into any type of exercise, it really should be everyone. And everyone has metabolism. So that's, there'd definitely be an argument for that.
Yeah, I've never come across a patient yet where they wouldn't benefit from a metabolic test. Honestly, everyone, we all should be participating in fitness, and we might as well do what's best for our metabolism. If we're going to put in the time and the effort, we might as well make sure that we're maximizing every effort we put forward to doing what our body really needs. And so I've found that there's really not anybody. The other week I tested, I believe she was 84 and on oxygen, and we did a metabolic test with her to make sure that when the exercise prescription we gave her wasn't going to overtax her, was in line with helping her build up her oxygen, her ability to use oxygen, and not leave her too fatigued so that for the rest of the day she was wiped out. And she's been progressing wildly. She's off oxygen now, other than at night, and she's doing so great. And it all started with a metabolic test, and that allowed us to show Medicare, like, hey, she actually is so deconditioned that this is a disability. We need to, she needs therapy visits to be able to get back in shape, and that's been great for us.
Right. So, it's got so many options, the metabolism, and there's the nutrition side of things, which is technically separate from the VO2 and the endurance side. Obviously, combining that bit of information together is even better, but it really opens your horizons.
Right. The nutritional component to it too really does open a lot of horizons. Helping an athlete understand how many baseline calories they should be eating, and then being able to give them precise, like, you will burn this many calories with this type of a workout, so that they know how many calories to add in above that baseline level, so that their nutrition is on point, so that they're not underfeeding themselves and having, bone stress issues and other just, fatigue related problems like plague so many runners. What a great thing to be able to provide.
Yeah, exactly. And I mean, even to the next level, that can be the cause of injury sometimes. People fatiguing because they're just not consuming enough carb, or they're listening to the pack of goo or whatever it might be. They're taking too much, too little. They're a high blood sugar, low blood sugar. Next thing we know, they're not running correctly. And that's actually the fatigue. It's not hip instability. It's not periodontal. It's just poor form based on fatigue. Right.
Yeah. Sometimes if you're not fueling those muscles right, they're going to fatigue quicker. If you're not fueling those muscles and tendons and ligaments and bones right, then they can't rebuild after each workout. And so we progressively get weaker and weaker. And that's when bone stress injuries happen, or tendinitises happen, when those tendons can't repair quickly enough to keep up with the load you're placing on them, either because you're overtraining or under fueling. That's a big problem. And the testing can really help people to understand where they need to train and how they need to fuel so that they don't come into those problems. What a huge difference we can give people. I love it.
Yep. So that's even before you put your hands on someone. So
right. Yeah. And then I'm with you there, that we still have those skills that if something does creep up, or if you have a nagging injury, we can still remove that roadblock and keep runners on the road. That's kind of my big mantra lately, is I want to keep runners on the road. Let's not let you have to have downtime. Let's keep you going.
Yep.
So how has this kind of transformed your practice? What has that done to kind of change the way you're marketing yourself, the way you're, who you're seeing and how you're seeing them.
Right. So it's interesting because, well, it definitely generates a lot of information. We have a very large sign in the intro with the guy with the big mask on, which that just generates conversation from comic book fans of Bane to Top Gun fans of Final Fight. And then obviously some of the endurance athletes who know exactly what it is. So in that way, it definitely has people talking. The big part of it is that it really did achieve the goal of, what to do for our runners and our endurance athletes. And it is really true. I said we felt like we were almost a running hub previously. Now it's really becoming that. A lot of our regular PT patients are coming in because they heard about us because, well, you guys are the running PTs. In fact, I met a doctor recently in a different context, and he's like, "Oh, wait, you're Outback? Oh, you guys are doing that great thing with the VO2 Max."
Yes.
Exactly. Yes. Well, that's a reputation. I like that. And, actually where and how you heard that from, but that's the type of reputation we want, because if we're considered the running PTs, that's one of our goals that we're trying to achieve.
Right. And you didn't have to go in and buy them lunch. You didn't have to go in and, market to them directly necessarily. The reputation did that for you. That's
exactly.
That's marketing at its finest, right?
Exactly. I mean, I'm just trying to think if this is a true statement. I haven't left the clinic to market the VO2 Max other than going to some gyms and doing a table, or some races and doing a table. But in the traditional marketing of, like you said, showing up with lunch or showing up with little gimmicks, you just don't need to do that. And online marketing has changed that, and things like Instagram and Facebook, where I'm sure you're having a look at this out there. That's really helpful too, because that's the way people talk. But like I said, this is we haven't even considered marketing to the medical world, which again is a whole new angle there. But it seems like they're hearing about it. Yeah,
which is great, and that's a whole new angle that if you decided in some way to expand your practice that direction, you totally can. It's not that that's not a viable option. A, you haven't needed to, and B, that may not attract the type of patient that you're kind of building that reputation for, or who is kind of really that motivated patient that's really fun to work with because they are so motivated. That is really fun when you get to work with people that really know what their goals are and are ready to go after them. Even if it is that 84-year-old patient, whoever's ready to really go after those goals, I love working with that type of person. And this does tend to draw those people in, right?
So yeah, exactly. You're not coming in just because you said it. You were speaking with your doc and your shoulder's sore, so go get some PT. You go, you need to do these exercises. You'll fix me, not I'll fix me type of a situation.
Right.
This is different. Right. People are actively seeking us out and looking kind of to the next level. So always enjoyable.
Yeah. Love working with people that are ready to move, take those steps forward, and definitely they want to fix themselves. That's an easy person to work with because we know we can hit their goals. Versus when it's all on the physical therapist to hit those goals, sometimes that's not sufficient in 1 to 2 times a week for 6 weeks, right? Especially because some of these problems that we're treating have built up for years. And so sometimes it does take a little bit longer than just 6 weeks. And the traditional physical therapy model sometimes doesn't always address that. So this gives us some avenues to be able to address things in a different way that allows people to really focus on their overall health and fitness and really achieve their goals and stay active and mobile and all those good things that we want.
Agreed.
So how has it changed kind of the atmosphere in your practice? What do you feel is different now?
Like I said, there's a vibe. It definitely does get spoken about. People are feeling good, and it's very common. People come in injured runners, and it's like, I want to get right to get on the machine. I want to put on the mask.
I love that.
Yeah, it was holiday time right now. There are a bunch of gift cards that were given as Christmas presents to injured patients. So, and like I said, that's a great goal. We keep talking about not when am I going to run, but when am I going to be able to run to fatigue to be able to get onto the.
I love it.
Kind of cool. It's my ACL patients, so we've got some time still. But it's pretty cool.
That's really cool. So I love finding ways that I can add value to my patient's clinical experience. if there's ways that I can add value and make them feel like they're getting more bang for their buck and more, real, true, usable value out of it, I love going after those things. And that's something that I found with the testing is there's a big group of my, traditional physical therapy patients that wind up becoming more metabolic patients as well. And so it sounds like you're seeing that as well, where you get that crossover of metabolic folks wanting or needing some help on kind of the rehab side and vice versa. And that crossover, obviously for business is really good, but it allows us to deliver so much more to each patient, have more options to help them really go after their goals instead of just kind of like, well, we got you back to where you were when you got injured. Good luck,
Yeah, exactly. Let us know how it goes. Exactly the same, exactly.
Yeah, and so being able to offer that next level is huge, I feel like.
Yeah, and it kind of draws back to what we were talking about before. I think patients or clients, they feel comfortable knowing that you're in the whole, you're part of that whole circle. So a metabolic patient comes in and they know that you're 100% aware of the anatomy behind what's going on, so that they feel comfortable. Or talking a little bit, if one of the PT patients is asking about the VO2 and you get into the whole side of things, most people, specifically in the area where I'm working, in between Harvard and MIT, many of the patients have a pretty, understanding of science or appreciate science. So when they hear stuff about the different levels and different metabolic consumption rates and anaerobic threshold versus aerobic threshold, those type of things, people get interested, and many people heard of it. Kind of like what we were talking about before, heard of it, don't really know what it is, but know that it's something that can be really important, and people just get drawn in.
Yeah, well, so being between Harvard and MIT, I imagine your average client is a little, definitely, like you said, more well-informed, but you probably get a geek out with them on the numbers and kind of the science behind it more, just because you've got that kind of higher level of awareness of what the numbers might mean and stuff. That's pretty fun.
Exactly, because there I am geeking out all the time, and it's kind of fun when I'm getting that return geek, because as you know, not everyone, a lot of people just come in and say, hey, just test me and tell me what I need to know.
Right, which is fine.
Some people that are referred, let's say, from coaches, where it's just speak to my coach, and it's like, that's cool, and that works well. But then you have the people that are just getting, they're salivating at the thought of all these, new numbers that they can look at, and heart rate zones, and how they can improve 80% here, 20% there. So yeah, it is. It's kind of fun.
Yeah, it is fun. It is fun just to see people get excited about it too. To get excited about fitness and to see fitness not as a punishment for bad eating or this thing they have to do so they don't die early, but really when it becomes about doing the things they love to do, and you're offering a path for them to be able to do that, that's huge, I feel like.
Yep. Yeah. Kind of fun.
Cool. Yeah, totally. I love it. Well, so it's been so awesome hearing more about your story. So how did you that's one thing we didn't talk about early on. How did you get to Boston, being from Australia initially?
Right. When I tell people that I came here for the weather, no one believes me. Mainly because it's not true. So I had no intention of moving to the States. I was minding my own business and met a woman who was abroad. She's from Boston originally, and so I thought I was going to do what a lot of Australian PTs do, which is go off and work in London for a few years, because it's easy for Australians to work there, and you can do a lot of short-term work where you can work for a bit and travel Europe and work. So I was going along that path like most of my friends. Met a girl from America, thought, okay, try my luck in the States. And that was about 15 years ago. So I always say most people bring back stuffed kangaroos when they come back to Australia. She brought back the full-size version. So where it was interesting is that PT in Australia, and this could be a whole much longer conversation. PT in Australia is different to PT in the States, at least when I first came out. I think it is heading in that direction now. But in Australia, you don't need a referral from a doctor, which is normal over here. But the thing is that you never needed a referral from a doctor. So the general public, if you injure yourself, the first thing you do is you go to your PT. It's called physiotherapy there. It's a physio. Yeah. So you go to your physio. So Monday morning at work in Melbourne, Australia, is everyone is coming in after the weekend from their basketball injuries, from their football where you use your feet, cricket injuries, which is again all different sports. But people come in and see us first, And so the training is really a differential diagnosis in knowing who's appropriate to treat, who's time to send out to the emergency room or to the orthopedic surgeon or to a different physician altogether when it's not
X-rays, scans. Yeah.
So it's different in that respect. It's also very hands-on focused. So a lot of the PTs in the States, big gyms where people are just doing exercises as opposed to private rooms where you're spending one-on-one time with it. So when I realized I was staying in the States longer term, and I always wanted to open up my practice, I just never realized it was going to be in Boston of all places. I wanted to open it in that similar method. That was the idea of Outback PT. So it kind of makes us think of Australia and technically the way that treatment occurs over there. And that's kind of how like I said, general sports and orthopedic practice started up, which has kind of turned into a running hub.
Right. Which is, honestly, I love that system better. As far as I understand, actually in Australia, physical therapy is the gatekeeper for orthopedic surgery, not the other way around.
Exactly. It makes so much more sense. Yeah, it makes more sense when
way more sense.
In the States, I was working for a different company and doing some marketing, and that was the marketing is like, you should want your patients to come to us first, because if it's a sprained ankle or a contusion or whatever it might be that's not surgical, then let us deal with them first. Why should you even bother about it?
Right.
Same with primary care. It's like the poor primary care, general practitioners are so busy with every single thing under the sun. Let's take away your basic sport, orthopedics, your musculoskeletal. Let's take that out of your hands so we can deal with it. And once in a while we'll have to refer back because it might be a little bit more, or maybe with an orthopedic surgeon. But more often than not, it's not the case, and we can free up your time to deal with more of your, gerontology, cardiology, et cetera, et cetera.
Well, I've seen some studies that would suggest, 60 to 70% of orthopedic surgeon referrals were inappropriate to go see an orthopedic surgeon. They should have come to see physical therapy instead.
Right.
And then triage to orthopedic surgery if need be. But that's
even if we take it to the next level, some people that may actually require surgery, surgeons aren't going to do surgery. They'll say, try PT for 6 weeks.
Right.
Even though, knowing that if it succeeds, great. If not, we'll do surgery. So why waste time going to the orthopedic? I mean, that was another very interesting thing when I first started working in the States. I was seeing a lot of these, what we call subacute, almost chronic type patients, because you wait a few days, you go to your primary care. They send you to the orthopedic surgeon. It takes a week or two. Orthopedic surgeon does a scan, gets that back. Actually, you need PT. It's 3-4 weeks since the injury. Just as well as any PT. Right. Dealing with someone 4 weeks after the injury versus 4 hours after the injury.
Right.
So
the difference is huge.
Yeah, and so it is. I feel like it is changing. I think that difficult is the pub where we as a profession need to market this as a team. It doesn't matter if you're coming to me or the guy down the road. Think PT first, and there's definitely a movement now, but that's what we're going to be pushing. So anyway, that's how I opened up my practice, was in that vein. Yeah,
more of a primary care provider mentality, and that's how I practice as well.
That's why we get along so well.
Yeah, exactly. More of that mentality though, of like, we should be that front line. We can triage and decide what's the most appropriate next step. If people need x-rays or scans or to see their orthopedic surgeon, I'm not opposed to that. Just statistically speaking, most people aren't appropriate for that. They actually should see their physical therapist first. And so let's go down that road first. It saves a ton of money. Saves everybody a ton of money.
Mm-hmm.
Anyway, so it's been awesome talking with you. I love it. We are definitely on the same page on so many things there. I love to see how the metabolic testing, the VO2 testing has just, really added some great value to your patients and clients and allowed you to serve them in a whole new way. And to me, that's what it's all about. The money aspect of things matters so that we can stay in business. But really, when we can serve our people better, it comes back to us, right? We wind up getting the money side of things taken care of because we're able to serve them in a way that they're not getting anywhere else, and so they come to see us.
Right, and it's I have this conversation with students a lot as well. I think everyone, not just PT, in general in healthcare, feel awkward when it comes to talking about money because we're healthcare providers, which is true, but we also have to pay the rent and eat food and all things like that. It is a profession, so this is definitely a different angle. It's at least in my practice, I believe the same in yours, it's cash based. So you're not dealing with the insurance reimbursements, which is the whole different kettle of fish. So those times it can definitely improve the bottom line, which is important, which also allows us to be better practitioners.
Right.
There's a whole other side of it because, like you said, it improves our reputation and just allows us to do what we want to do.
Right. Yeah, it allows us to really focus on the patient instead of focusing on a diagnosis. Oh, they're a knee patient. Or focusing on, oh, they've got this type of insurance, so we can only do this.
Right.
This allows us to be able to say, this is a patient that has a life. This is what they really want to accomplish. It's not about pain, because there's a million things they can do for pain. They can be on pain meds. There's a million things they can do for pain. Really, why they're coming in to see me is the pain is making it so that they didn't get invited to go play football or soccer, with their friends. And so they're feeling left out. So they're coming in to see me because they didn't get invited on that run or on that fishing trip or on that, whatever that is. They're feeling like they're missing out, or they're afraid that they will start missing out on their own life. And so they come in to see us, not so much for the pain, but to really get help with living their life on their terms. And so by doing the metabolic testing, by kind of being, working differently with insurance, it allows us to treat a person like a person and find out what their needs are, what their goals are, and then kind of tailor their plan to them.
Agree. Definitely.
Yeah. So anyway, I love it. And so thanks for bringing some of that Outback style and Outback mentality of how to work with people in my opinion, a better way here to the States, so we can start making that transition. I love what you're doing there at Outback. They're a really fun follow actually on Instagram, because they post a lot about the metabolic tests that they're doing, and they do fun animations with it and stuff. So I really enjoy following them. So check them out on Instagram, Outback PT, and Facebook, Outback PT. Yeah, they're great. So thanks so much.
Also, because we never would have got into it without the coaching and the guru who's on the other side of this screen. So if there are any PTs listening that are interested in getting into this, that's your man over there. I mean, I'm also happy to help out now, but I feel like go to the source. A wealth of information, truly passionate when it comes to VO2 Max testing, metabolic testing on the whole. So he's doing some great things over there out west.
Well, thank you so much. I appreciate it. I love teaching. I love helping people and helping people learn and growing their practices. And so, yeah, thanks. I appreciate it. Definitely look forward to helping anybody that wants to learn more about it, for sure. Feel free to reach out. So Metabolic Testing for Clinicians is our site where we teach people how to do the testing. So if it's a Facebook group on Facebook. So if you want to learn more, go ahead and look that up. But definitely love sharing this with anybody. So thanks so much, Ithamar. Happy to have you in. What a great thing to learn more about your practice, and excited to share this with others. Thanks so much, and we will catch you next time.
Bye.
Thanks for listening to the Body Smart podcast. Join us in the Body Smart community on Facebook to share your successes or ask a question for our next episode. Now get out there and take the next step toward living your active lifestyle.